Thank you very much. Let me start from Kwali-Kroti. Honorable Dr. Zenator Rawlings.
Thank you, Right Honorable Speaker, for the opportunity to contribute to the statement made by the Minister of Health. Mr. Speaker, Ghana is well known to be a hub and a transit point for illicit drugs. But this particular phenomenon that we're witnessing is quite shocking, actually. As a matter of fact, in my constituency, we have a cluster of schools, the Niamugi cluster of schools, where people who are addicted to drugs have actually invaded the premises, where they harass children, they harass the teachers, and recently, in the last 3 weeks, one of the security personnel in the school was attacked by a gang of drug addicts and is now in 37 military hospital in a coma. Mr. Speaker, the ramifications of this illicit drug inflow into Ghana goes beyond the large scale, but it's affecting people's lives. It's affecting the security in our schools. It's affecting the security of our ordinary citizens. And Mr. Speaker, the law enforcement agencies responsible for this need to be strengthened. We had, up until a few weeks ago, collaboration between the U.S. government, specifically the Bureau of International Narcotics and Law Enforcement Affairs, with the government of Ghana in helping to combat some of this transnational crime and illicit drug use. Since the suspension of this, Mr. Speaker, I believe that may have contributed to what we are seeing. We need to re-engage some of these international agencies and strengthening our capacity to monitor what's going on in our borders and ensure that when we actually do track down these criminals, the prosecution of them and effective implementation of our regulations is actually done in order to be a disincentive for those who wish to use Ghana as a transit point. Our youth are really increasingly becoming a target of all of this. And Mr. Speaker, this is a national security issue because it affects our country in so many ways. It's affecting so many sectors, and it will probably be something that's affecting a lot of communities. My constituency has a very high level of addiction, has a lot of young people who are addicted to drugs, and unfortunately, this is an issue that has been swept under the rug for too long. And it is my prayer that given the expose that has happened, the global embarrassment that we see now, we will take this issue very seriously, the issue of addiction and mental health and how we address the way drugs are used in this country. Thank you very much, Mr. Speaker.
Thank you very much. Let me start with my senior member for Asante Achem Central.
Thank you, Mr. Speaker. And may I congratulate the Minister of Health for the statement he's made to the country in drawing our attention. Mr. Speaker, I pardon my ignorance, but it looks like this opium is becoming a serious matter in the country. I heard the minister talk about the fact that some arrests were made, they were taken to court, and the court gave an order that the substance be destroyed. I, however, didn't hear whether that was effected, the destruction. Another serious matter is when something that is not good for the country is directed to be destroyed, and yet it finds its way back into the country. So from the minister's statement, one would realize that the law enforcement agencies are already working. But I would want to draw the minister's attention that customs, they control the borders. And I didn't hear the minister also talk about the Narcotics Control Board, which we have in the country. I did not hear, that's what I said. So I would want the minister to work very hard so that these two institutions would collaborate, because when they are found into the country, it is very difficult to control. The police may not be able to track all, but when they are coming into the borders, they have to know. I haven't seen one before, and I believe that some customs officials may not even know what kind of substance we are talking about, unless they have to be trained. So the minister must make this conscious effort so that there will be collaboration between the Narcotics Control Board and the Customs Excise Division to make sure that this menace is brought to a halt. Thank you, Mr. Speaker.
Thank you very much. Let me go to Professor Bayo.
Thank you very much, Mr. Speaker. I want to commend the Minister of Health and the Ministry for the swift action, and the agencies under the ministry for handling what appears to be a national public health crisis. Mr. Speaker, opioids are good servants, but bad masters. They are drugs used to manage moderate to very severe pain, and they are therefore very useful in the health system. However, if unregulated, they can be very devastating. These drugs, when considering what we call euphoria, which is what they will call in lay term the high, and therefore they also exhibit something we call pharmacologic tolerance, which is that with subsequent consumption, you need to take higher doses to have the same effect. So the youth who engage in these drugs easily get addicted and have to take higher doses to get the same effect than before. And they are causing a lot of damage to our youth. The issue raised by the BBCI investigation, in my view, smacks of deliberate poisoning, because these drugs were not made for any medical purpose. They have never been used anywhere. And the combination is a terrible combination of a potent maxillary relaxant and a very addictive opioid. And when you take these two combined in one formulation, it is unacceptable. So I want to commend the ministry for what they are doing. And for us as a people, our biggest concern is that addiction will have a serious drain on us. Addictions are better prevented than managed. As a country, public rehabilitation centers are not more than 3. We have very few rehabilitation centers. And the outcomes of rehabilitation, especially of drug addiction, is also not very promising. For every 10 patients who go to rehabilitation, just 3 to 5 may successfully get out of it. Relapse is very high. So for those who get hooked onto it, getting out becomes a serious challenge. I would therefore want to commend the ministry, but ask that serious intersectoral collaboration is needed. This is as a result of pure regulatory failure. This House has passed several laws, including the Narcotics Control Commission, their act, the FDA Act, and all these empower state agencies, the Ghana Police Service, Pharmacy Council. But what is happening is that it looks like almost all these agencies have failed us in one way or the other. And so I would urge the minister that as they are going through the administrative processes, we should also ensure that the criminal processes are followed. Because if you bring an unregistered drug into the country, it's a crime. And those who commit that crime must be punished. Thank you very much, Mr. Speaker, for the opportunity.
Thank you very much. Yes, let me listen to.
Thank you very much, Mr. Speaker. Mr. Speaker, I want
You wouldn't even wait for me to mention your name. Anyway, let's hear you.
All right. Mr. Speaker, I want to commend the minister for bringing to the attention of the entire country this national canker. Indeed, the opioid is a worrying trend. Mr. Speaker, now what the youth do is that they do not only take the tramadol, but they mix tramadol with energy drinks, which contributes to the highness. I mean, and virtually every assembly of young people that you see in this country, you realize that that practice is going on. I mean, in my constituency, sometimes you find out from the young people how they are able to get tramadol, and they tell you that now tramadol even they have ghettos, like the way weeds are sold in ghettos and all of that. People have tramadols in their bags, and at all times when they need it, they apply it. Mr. Speaker, it's a challenge. I remember when I was involved in an accident, and I was admitted at Ridge Hospital. The intake of opioids was quite regulated, but you could easily get it. I mean, they can prescribe it for you, the doctors will prescribe it for you and all of that. And at a point, even me myself, I was nearly getting used to it. I mean, every time when the pain comes, you would ring bells, calling on your doctors to, as it were, prescribe the medicine for you. But Mr. Speaker, last year when I traveled to Germany for another medical procedure, before you are prescribed an opioid, you need to go and see a pain doctor. And when the pain doctor prescribes for you the medicine, and you take the medicine to a pharmacy, you will not get the medicine on the counter of the pharmacy. So what they do is that you submit your prescription to the pharmacy, and you are given a period of 6 hours to come back for your medicine. Then we asked them, why do you do that? What we found out was that such serious drugs are not found in the pharmacies. They are regulated, they are controlled somewhere. And so if you bring your prescription, then they now send your prescription to those centers, and it gets delivered to you. So when that is done, then the entire ecosystem of opioids is regulated. But in our system, that is not what is happening. Every pharmacy that you go, when you mention that you want tramadol, you will get it. When you mention that you want pitidine, you will get it. All the very, very high drugs, when you mention to our pharmacists and present to them a prescription, such prescription, you don't even know hospitals that are prescribing them, whether they are coming from proper doctors or people sat in their homes and just use some coral draws or some papers to prescribe them. We don't even know. So we ought to look at it very well, Mr. Minister, how we control such drugs in the system. It's very important. And for me, I think we need to start punishing pharmacists that easily release these drugs to our young people. It is destroying our youth, and I think it's important that we find a way of, having a more stricter controls in the release of such drugs. Thank you very much, Mr. Speaker.
Yes, let me come to Felicia. Quintampo South.
Thank you for the opportunity, Mr. Speaker, to contribute to the statement made by the Honorable Minister. Mr. Speaker, 7 parliaments have made a statement about tramadol. Tramadol, I don't know how it got into the system. I remember one time I was going to my normal campaign and I met one gentleman. The guy was almost dead. In fact, when I saw him, I thought the guy has passed out or something. So they were like, oh no, Honorable, he's fine, he'll be okay. I said, okay, at least let me take him to the hospital. They said, no, we should leave him like that. Honorable, he'll be fine. And true, Mr. Speaker, I came back in about 5 hours time, then I saw the guy sitting down eating. Then I said, why? What happened to him? They say it's tramadol, but they call it Tramor. At the village, that's how they call it, Tramor. And Mr. Speaker, you see those boys that they use bicycle going around in our communities. Some of them use motorbike. They sell all kinds of medicine. They can give you medicine for anything. Mr. Speaker, yes, they can give you medicine for maybe white or infection. Mr. Speaker, The last time I went to America, I think it was around spring, and I always have allergies. And there's this medicine called Claritin D. Then I realized that when I was going to buy, I buy one pack, and I said I wanted to buy two, so that I don't have to go back to the pharmacy. They told me that no, I even have to show them my ID. And there are certain communities in Ghana here that Tramadol, they sell it over the counter. Meanwhile, it's a prescribed medication. I was sick and they gave me Dorita. Then I asked my doctor, I said, you gave me this medication, but I've been sleeping like all day. That was when I realized that Dorita have Tramadol inside. Mr. Speaker, honestly, it's about time. I thank the Minister of Health. It's about time for us to take charge and control over this Tramadol because it's destroying the youth. Just recently, I found out that Tramadol, they have about 25 or 250 milligrams. Mr. Speaker, I know people that take this medication or this medicine, and it's really destroying our youth. Because when they take it, I heard that it can, anybody who's trying to, who is doing farm, the Tramadol, when they take one, it can help them to read about maybe 1 acre. And the person is 30 years. When you see the person, like the person is 60 years. The Tramadol is really destroying our boys, especially the youth. I'm very glad that the minister is here and he made a statement himself. Right, Honorable Minister, in fact, we believe you, we trust you. That is why you are here. Because, Mr. Speaker, this is long overdue. Mr. Speaker, we thank you so much for the opportunity and thank the Minister of Health too. Thank you so much.
Yes, you are a pharmacist, eh? Are you a pharmacist?
Yes, Mr. Speaker.
Okay, let's hear you.
Thank you very much, Mr. Speaker. And let's thank the maker of the statement, the Honorable Minister for Health. Mr. Speaker, each one of us will experience a certain type of pain one way or the other in our life. So the need for a pain medication is critical. So all of us will one day need a muscle relaxant. So the need for us to have muscle relaxant in the system is also critical. But what we are seeing in Ghana, this opioid crisis that is about to hit us to the level that it can be likened to dropping the atomic bomb on Hiroshima and Nagasaki. Mr. Speaker, the tapentadol, the brand name is Nucynta, that was first approved in the United States in 2008 and 2011, has been in existence. They call it class 2 drug. It's because the level of addiction is even higher than the Tramadol. And it's been in existence and they've been using it. So when you go to the Carisoprodol, which is the muscle relaxer, it's one of the oldest drugs that they have generics on it. They've been using all this while. Mr. Speaker, the issue here is one, this statement should have even been done in collaboration with the Minister for Interior. Because it's not only the health minister's issue, it's issue of export and import. So that is the first issue. If we can regulate our customs and our ports, then we'll be able to find what is coming in and what is going out. Because this active ingredient, Mr. Speaker, could even come into the country as a raw material before it can be produced. It can be used to produce into the drug. So this statement, I believe that we should have the Minister for Interior and the Minister of Health give us a joint strategy as to how they are going to curb this menace. Mr. Speaker, after that, then we will come to what we call the local manufacturing industry. The pharmaceutical industry locally is supposed to be strengthened and be given enough resources so we can start producing these drugs within our country and we can properly regulate it. If we are not allowing, because they are generics, these drugs are not brand new drugs, they are not the original brands of the drug coming from India. They are generic drugs. Sometimes you have countries like the United States, Europe, and others, they're coming out with these new drugs, and we tend to produce the generics. This country has enough aspects that we can build their capacity and build the local pharmaceutical industry with enough resources so we can produce it here. In that case, we can have a proper supervision. When we produce in here, then the issue of internal regulation becomes something between the Food and Drugs Authority, the Pharmacy Council, and the Medical and Dental Council, because it's not only the dispenser. We can have the pharmacy dispensing based on prescription. But we have medical doctors who are also will be tend to write these prescription drugs for people who will be using it for improper use. So, Mr. Speaker, this is something that we have to refer it to a committee to have a further engagement on how we as a country, we will not go further, because tramadol, if tramadol can cause a defect to our country, Nucenta will make it worse. So it's critical that we have a joint statement or direction coming from both the Minister of Health and the Interior Minister, and we'll look at what other countries have done that have dealt with this opioid crisis over the years. We don't have to reinvent the wheel, and I believe we can do a good job. Thank you, Mr. Speaker.
Thank you. Honourable members, let me take the last round, because we can't go on and on and on and on. Let me take the last round. So you are all yielding to Dr. Mack. So, Mack, let me hear you. Then.
Thank you, Mr. Speaker, for the opportunity. And I want to thank the Minister of Health for acting promptly to bring this statement to Parliament. I think we're discussing it on our platforms to ensure that we have such a statement on the floor of Parliament. Mr. Speaker, today's discussion is not new as such. Over the years, there have been drugs that has come into the system to destroy our youth, medical staff, etc. There was a time we had Petidin, a drug that when you give yourself that injection, even though it's a painkiller, it will also give you the symptoms that I'll soon be mentioning. After that, so many other drugs have come to pass, Toradol, and now it came to the turn of Tramadol. And now the people or those out there have realized that, no, we have carried out a lot of education on Tramadol. So they now want to change. They are bringing in new drugs that we don't know. Everybody now knows about Tramadol because of the good education that we've carried out, even though it is still being used and abused. But they are bringing new drugs. Tabendadol, Carisoprodol, for people to know that today we are talking about drugs that can kill you by just taking them. Yes, there are medicines that have been approved in some countries and probably might be subjected to the same process in Ghana here. But there are medicines that need to be controlled. There are medicines that need somebody to prescribe for you and somebody to dispense. They should not be sold openly. And now they are finding their way into the country in quantities beyond what medical care needs. And I want to appeal to the Food and Drugs Authority that they should look at this problem holistically in approving any drug that will come into the society. Sometimes they are coming to do the same thing, and we already have a drug that is, providing that service. What is the need to bring in some new drugs. We should have statistics. We should know the amount of said drugs that are prescribed